this is Chloe. We're gonna get her ready for her spay today. So what we're gonna do, we're gonna get her prepped on the wet table, and then we're gonna transfer her into surgery room.
You ready, Freddie?
Now that Chloe is all prepped, we have her now in the surgery suite. We have her hooked up all to our monitoring equipment, so that way we can monitor her heart rate, her respiration, and her temperature while she's underneath anesthesia.
Hi, this is Dr. Tillema. We're here in our surgery suite. Basically what we're going to do is we're going to make a ventral midline incision. Here's the umbilicals here. This is the basic Spay surgery. I'll probably go down not quite a centimeter, and I'll make a slight incision here. And at that point, what we'll do is we'll basically get the ovaries and suture that. Not the ovaries themselves, but the vessels that are connected to it. And then we'll also basically suture and remove the uterus. It's called an OVH, which is an ovarian hysterectomy. So we will remove that from her so that we don't want any unwanted pregnancies, anything like that. We have enough pets and unwanted pets in shelters. We don't need any more. So the owners are doing a good thing. We're helping them out financially with low-cost spay and neuters. So with that, I'm going to get busy. Okay guys, we just finished a ovarian hysterectomy on Chloe here. Basically, we were starting to go into heat. We weren't completely in heat. Basically what we did is remove the ovaries and the uterus. And post-op, we were acting like we were vomiting. The thing is, we always want to keep the head low. We're not going to remove the actual endotracheal tube, which is what we put in the trachea for gas anesthesia. We're not going to remove that until we know for sure that that's done. If they vomit, the risk that we have, and the reason that we tell people not to feed their animals the night before, because if they have a full stomach with food, post-anesthesia, they vomit. Some of that can be aspirated, which means since they're under anesthesia and they're not fully awake, they can actually have some of that vomit go into the lungs, which can create pneumonia. So we don't say that just as, yeah, just go ahead, no food after midnight. It's a very important point, because the last thing you want to do is create an aspiration pneumonia case post-op. So right now our patient's head's a little lower than it basically should be, just in case we do vomit anymore. We are recovering uneventfully. Surgery was a success. And a lot of times what I try to do, not always, but sometimes what I'll do is I won't put the sutures on the outside. It saves the owner a lot of time from having to come back in for a suture removal. But they do have to have an e-collar on for a good, I'd say a good couple weeks at least. Usually within 10 to 14 days they're fine, but we need that sutured site to heal. So at this time we'll basically be giving, vaccines, pain medications, and a prophylactic antibiotic at this point. So she's waking up, so I have to go, but have a great day, and I'll catch you on the next surgery. Take care. Bye.